Hello everyone. If you want to know one person who is great at dealing with pain, is Dr. Justin Dean. He's an amazing physiotherapist, as in his techniques are awesome. I've had quite a number of terrible injuries as a dancer, and he has always helped me with corrective measures. I'm healing now. I tore a major ligament inside of my knee, and just off the phone consultation that he did for me, and I'm feeling already better. If you're not with Dr. Justin, then you're not at the right place to heal your pain. He's Mr. Fix-It.
I was experiencing a lot of knee pain and wasn't able to work out for about 2 months when I came to see Dr. Dean. And I would say after about a few visits, maybe even by the second visit, I was feeling so much better. I had so much more mobility, was able to feel pain-free about the 4th visit and ready to get back to being active. I've never actually seen a doctor who cared so much and was so attentive to his patients. It was a combination of treatment and at-home exercises, and that really showed throughout every visit and also thereafter, and how I
It does make sense.
highly recommend Dr. Dean if you are looking for chiropractors in the West LA area, or even if you're from out of the city and wanting the best care possible.
My name's Aaron. I'm a grad student at USC. I'm in biomechanics, and I've seen Justin for about 5 years on and off. I played college football when I was in my 30s, and that really kind of broke my body, and he's helped kind of piece me back together. And he does a good job of listening to me and hearing what I really, the problems I really do have, instead of just kind of going off of his own expertise, which is great because you don't get that a lot with certain clinicians. I've had a lot of hip and lower back problems, and my right side was really good. My left side, I couldn't move it at all. And after a couple sessions, he's really opened it up.
Never give up.
I feel really great.
I always knew Sam Moore, the volleyball player, and when I was told that I couldn't be the volleyball player anymore, I didn't want to know Sam Moore without it. The only thing is the evident need for a full knee replacement, and so I scheduled my knee replacement, and I went to University of Portland actually for a dermal traction method clinic with Dr. Justin Dean. I went to learn about the science. I went as a student, and when he asked if anyone in the room had knee pain, I raised my hand. Within 15 seconds of him working on me, I squatted pain-free for the first time in 8 years. Justin Dean gave me my life back.
I feel them in it's like in my spine itself. Yeah. Ah. Yes.
Oh, I like that.
Okay, breathe in, breathe out. Give me like a baby, like your baby June right now. There you go. Breathe in, breathe out. How do you feel?
Wow.
Thanks for coming out, guys. Thank you. Dr. Justin Dean from Dr. Phillips now. Yeah, I mean, a little history on this. We've been pretty much working on this for about, kind of the idea came up in 2013? I think that's about right. And so this has been quite a bit of development, and so a little bit of structure and organization. We are teaching you a foundational system on how we look at the human body, but every skill and tool you have currently, you can apply and plug in at any point during this course. We've got a great group here. Currently, we're going through the patient histories. So if you're a chiropractor, physical therapist, massage therapist, anything in the healthcare industry, this is for you. And basically, this is a results-oriented course. So we prioritize the nervous system to get you out of pain very quickly, as well as determine what exercises you need to do to keep you out of pain.
Getting started with Dr. Justin Dean, day 2. So Justin's going to lead off today on day 2. This is the upper quarter course for the neurocentric approach, our inaugural weekend. We also teach a lower quarter course as well. You can go to neurocentricapproach.com and find our event schedule. We've got 4 dates coming up in Portland, Oregon currently, and we're booking new dates at present.
Anyway, so today we're going to be continuing along the path, and we're going to be traveling outside of the diaphragm and working into the peripheral nervous system. This is what I like to call my COVID baby. This is the stuff that I was working on. Wrap around the base of the occiput, okay? Right along the ridge. The other hand, we're kind of pinning down the CT junction. You're going to pull up and down to create tension in the skin, because it's in the skin here. Up and down, a little bit of distraction, flexion, contralateral rotation, contralateral flexion.
Christine, and this is my baby Grant. He's 4 months old now, and the reason we come to Dr. Dean is because he was having so much trouble with his digestion and he wasn't able to poop for many days. When we first brought him, we were so scared because it had been almost 10 days since he had pooped. And once we brought him to Dr. Dean, that night he went, the next day he went, and it's been much more regular. Every time award-winning smile, giving you award-winning treatment. And we're very excited because it'll make him feel so much more comfortable and he will sleep. And that's such a big thing for us because we've been at 2.5 hours of sleep a night at a time, and it's very hard on mom and on baby when there's no sleep.
Dr. Justin Dean is your man. He's my man and always will be. Thank you so much for taking care of me.